Hi, it's Dr. Neil Gerrard here from Clifton Dental Studio to talk to you about how you can transform your gummy smile. So I'm not talking about smiles that can be easily treated using muscle relaxant injections, what you see as advertised all over the internet as Botox to relax the lip and treat gummy smiles. I'm talking about the alternatives to that where muscle relaxant injections are just not enough, will not give you the results that you need to transform a really gummy smile into something that looks normal or significantly improved. So over the next 10-15 minutes, I'm going to talk through what causes the gummy smile and then what you can do to improve that. So let me move this little screen around just one moment, and then I can show you some photos, images to help explain what options are available to you. So correcting gummy smile. So if you've got a gummy smile which looks like this, one of these images here, then it's more than likely that using muscle relaxant injections is not going to resolve the problem, not going to improve things significantly enough for you. But that's always an option that you can try when you do have a gummy smile and it's something that is impacting your life, that you're very self-conscious of. If you're hiding your mouth when you're taking photos, smiling in public, things like that, then it's definitely worth trying that. But what I would say to you is that once your gummy smile gets beyond a certain point, that the muscle relaxant injections are really not enough and you need cosmetic dentistry to help with that. So this is the type of impact that we can have as experienced cosmetic dentists in gummy smiles, and I've been treating gummy smiles for 20 years or longer. And I'm not talking about, again, muscle relaxing injections. We're talking about gum lifts and then cosmetic crowns and veneers. And this image is a classic example of the changes that we can make to the gummy smile. So a gummy smile is considered to be gummy when you typically show more than about 3 millimeters of gum. Now it's normal for ladies to show a little bit of gum, and it actually looks more attractive to show a little bit of gum. It looks more youthful to show a little bit of gum as well as a woman. On the other hand, for men, it doesn't look very attractive at all to show gum, and we've got many years of research that shows what typically looks good and what doesn't look good for most people, and that line is about 3 millimeters for women, and for men it's not normally any gum at all or just on the gum line itself with those. Now typically what we find is that women are twice as likely to have a gummy smile than men do. So, and most people that we see, or most patients that I treat, are actually women. So here's about 40% of the population of women and about 7% that is men. So there's three causes of a gummy smile. Excuse me. There's three causes of a gummy smile that you should be aware of. And this will help you understand what treatment will work for you and why some treatments aren't suitable. So one of the causes of gummy smile is a short or overactive lip, meaning that when you smile, the lip goes up much higher. It moves a lot more than it would for most people. And the singer Gwen Stefani is a classic example of this. You can see that she's showing a lot of gum when she smiles, but that's because her lip is a little bit shorter than the average, but also it moves up a lot when she smiles. We also have another reason for gummy smiles, and this is Eddie Murphy, and Eddie Murphy has a gummy smile here. His gummy smile is due to small teeth, or that the gum has grown over the teeth a little bit too much over time. So that type of gummy smile is not due to the lip being too short or the lip moving too much. Eddie Murphy has a normal lip and it moves a normal amount or an average amount. It's because his teeth are smaller or he has too much gum. And then we have Beth Tweedley here, who's the British gymnast. And the third reason for a gummy smile is because there's excess upper jaw growth. It's where the jaw has grown down lower in the face than what we would normally expect to see. with that. And then we can have a combination of all those three, where the lip is a little bit short, it moves a little bit too much, the teeth are small, and the jaw has come down a little bit too low as well. And often it is the case that we are dealing with combinations of these three things. So short or overactive top lip. Now, what are the treatments for this? Now, this is where muscle relaxant injections are most likely to be effective and work for you if you're in this category. So what you normally need is normal sized teeth, not an excess of gum. You've got a normal amount of gum, it's just that the lip is a little bit short, or the lip wants to move very high every time you smile. Now this is, as I said, where you want to use muscle relaxant injections, what would be advertised on the internet as Botox injections, to stop the lip from moving as much. Now there is a limit to how much of these injections you can use, because you still want to be able to move your lip. There's no point in stopping the lip moving completely where you can't talk, you can't smile at all. That's not going to work for you. So there's a bit of a balance by how much you can add of these injections so that your lip still moves a little bit, but you show less gum. And this is the impact or the effect that they have using muscle relaxant injections in this particular case. You can see that there's much less gum on display. The lip actually looks a little bit fuller. There's no lip fillers in there. The lip looks a little bit fuller because it's not being pulled up as high by using the muscles that pull the lip up. We've relaxed those, so it helps hold everything down just a little bit more. Okay, with those. Now that's something that I've been treating. I've been using muscle relaxant injections for wrinkle treatments, and for this again for 20 years or slightly longer now. So this is an example of where we have small teeth or too much gum growth, where the teeth are normal size, the lip is normal, but the gum has grown down over the teeth. And again, this is the before and this is after this gentleman that we treated, and you can see it's completely transformational. We've given him normal sized teeth, we've given him less gummy smile, and it completely changed his life. And then the third reason is the excess upper jaw growth, where the jaw has grown too low in the face there. And this is an example of that, and it is pretty severe. It's one of the more severe cases that I've ever actually treated here. And then this is the before and the after. Now, depending on the severity of how much growth we get, there is still a limit to how much we can improve things. Can we give you a perfect smile? No. We may be able to reduce the gum that shows down up to maybe, or down to rather, 3 to 4 millimeters, which is in that acceptable ballpark of the research that shows that if you have gum 3 or 4 millimeters, that most people would still say that's acceptable and normal with that. And then again, the before and then the after, and you can see what a transformation that makes. And this individual has got the option to use some muscle relaxing injections as well if need be. What we tend to find with most people, once we treat them in this way and they see these type of results, that's enough for them. They feel that they don't need the muscle relaxing injections, and they're very happy with their final results that are there. And then, as I alluded to before, we've got a combination of all those three causes, where we've got the slightly shorter lip, the lip that moves a little bit more, we've got the shorter teeth, and we've got the jaw that's grown a little bit lower down than what we would normally expect to see. And then I've already shown you this, where we've got the before and the after. And again, this is looking at the full face here. This is the before and this is the after, and a significant difference, as you can see with those. So again, some of these cases have been treated many years ago, some more recently, but basically the causes are the same, and it's a case of when we come to treat these, the techniques and the options are still the same. So in these cases, All three cases we've completed by using a gum lift, where we've actually lifted gum, whether that be using laser or other techniques, and then we've used some cosmetic crowns or veneers to improve the size and shape of the teeth, and sometimes the colour. That's depending on you as an individual, whether you want a whiter smile, but we've used cosmetic crowns and veneers again to improve the size and shape of the teeth, to balance everything and give those results that you've seen. So this was the before of those three cases, and then the after, and they are the three same individuals. I'll go back to that, the before and the after, and you can see the huge difference that that makes. And all three treated with the gum lift and cosmetic crowns and veneers. And then the before, looking at the full faces, and the after, again, I'm sure you agree that that makes a huge difference. And looking at these individuals, muscle relaxing injections may have helped with the two ladies, but the gentleman, it wouldn't have made a difference at all, because his lip was normal and it didn't move in terms of excess movement. It moved in a normal amount. And the two ladies here, it would have helped a little bit, but nowhere near the change that you see at this point in time, or they would have ended up with a lip that just didn't move. It was just, the lip was stationary with no smile. And that's sort of what Beth Tweedley gets in that photo there. She's trying to smile, but it's very, very flat looking. This is myself and my wife, and the reason I put this image in, and we're attending the British Academy of Cosmetic Dentistry annual conference in the last couple of years, where I'm an examiner and a fellow of the Academy. So I help educate other dentists in terms of treating smiles, as I've just shown you. But the reason she's there is because my wife was one of my very first patients that she let me practice this on. And this was in 1999, and we are a few years older now, 1999, and she had small teeth and uneven gum line from one side to the other. And that was the before, and this is the after. So 1999 and 2022. Now we changed that. We changed her smile many, many years ago, but this is one of the more recent photos of her smile just a few years ago. And you can see that the teeth are much more average in size, and the gum level is much more even. And if she really forces a smile, she can show 3 or 4 millimeters of gum, but most of the time it's within that 3 millimeter or less when she's smiling. This is what also spurred me on to get interested in treating gummy smiles and really helping people with more extreme gummy smiles, again, where muscle relaxing injections are just not going to give the results that are required. And then photo a little bit more recently again of what her smile looks like now. Different haircut, different hairstyle, colour, but you think that the teeth are, again, much more even in size and much more symmetrical as well in terms of the gum line. So if you're looking to change your smile because you're very conscious of a gummy smile, as I said, you've got 3 main causes of that, and basically 2 options, and one of those is the muscle relaxing injections, which you may be very suitable. Remember, if you've got normal sized teeth and it's your lip that's a little bit short or it moves too much, then that's where they will work. But if the lip is relatively normal, but you've got smaller teeth and an excess of gum or jaw growth that's too low, then the more cosmetic options are what you're looking for to achieve these type of results that I've showed you today on this video. So if this is something you'd like to investigate further and experience our expertise in changing these smiles, then you're more than welcome to give us a call. You can email us on info@cliftonsmiles.co.uk, or you're very welcome, if you're just starting to look into this, is visit our website and see some more of our before and after examples of patients that we've treated over the last 20 to 25 years in terms of general cosmetic dentistry, but also in terms of gummy smiles, gum lifts, and cosmetic crowns and veneers. So I hope that was very helpful for you. As I said, if you like information, don't hesitate to contact us and speak to one of our smile advisors. Thanks for watching the video, and we look forward to helping you transform your gummy smile in the near future. Take care.